Hello friends, in this video we will discuss what is to be disclosed while obtaining consent for treatment. There is lot of confusion as well as debate what exactly has to be included in the consent form. So in this regard, let's discuss Supreme Court guidelines. Here I am referring a famous case, that is Samira Kohli versus Dr. Prabha Manchinda case, where Supreme Court has given certain guidelines in 2008. In this case, Supreme Court summarized the principles relating to consent as follows. Supreme Court says consent should be based on adequate information concerning the nature of the treatment procedure so that the patient knows what he is consenting to. Here what is meant by adequate information? So here Supreme Court says doctors should disclose the nature and procedure of the treatment and its purpose, benefits and effect, alternatives if any available, an outline of the substantial risk, and lastly any adverse consequences of refusing treatment. Supreme Court further says, but there is no need to explain remote or theoretical risk involved which may frighten or confuse a patient and result in refusal of consent for the necessary treatment. Supreme Court further says, similarly, there is no need to explain the remote or theoretical risk of refusal to take treatment which may persuade a patient to undergo a fanciful or unnecessary treatment. So this case gives us a very important take-home message. So whenever a doctor prepare a consent form, it is desirable or advisable to prepare specific consent forms for all the routine, major and minor procedures. We are aware that most of the hospitals uses a general consent form or a blanket consent form. If we go by the Supreme Court guidelines, such general consent form applicable to all procedures will not be valid. So, my sincere request to all of you to prepare specific consent forms for the procedures. While preparing such specific consent forms, include all the above points, that is A to D in it as already discussed. Also, put a note on the top of that consent form that this consent form has been prepared as per Supreme Court guidelines given in the Samira Kohli case. Why I am advising for this note? Because whenever a case goes to any consumer court or any other court, the consent court will come to know that you have followed the Supreme Court guidelines for preparing or taking this consent form. And I am sure that will give a specific benefit to the doctor. Thank you so much.